Hello, and welcome to the WellFirst Health Medicare Advantage Sales Webinar. My name is Jared Hamill, and I am one of the Medicare sales executives here at WellFirst Health. Today, we're going to cover some key insurance terminologies. We're going to talk about the 4 different parts, or as I call it, the alphabet soup of Medicare. We're going to talk about how Medicare Advantage plans work. We're going to talk about how Part D works. We're going to talk about the different enrollment periods and who is eligible. We're going to go over our 2022 plan benefits. We're going to talk about some things to consider when you're shopping for Medicare plans. And then finally, how to enroll. So there's some key insurance terminologies, and a lot of these are the same regardless if you're talking about like health insurance, life insurance, auto insurance, homeowners insurance. Some of these terms are the same across the board. So the first is premium, and that's the amount you pay for your insurance coverage. Cost sharing is a general term used to define any amount you pay out of pocket with insurance. And the next 3 things I'm going to talk about are all forms of cost sharing. So the first is deductible, and that's any amount you pay before any other coverage level starts. So I like to use auto insurance as an example here. So let's say you have a $500 deductible on your auto policy and you get into a car accident. You take your car to the body shop and they tell you you have $2,500 in damage. You have to pay that $500 deductible before the other insurance or before the auto insurance will pay their $2,000. Copayment is a flat dollar amount that you're responsible for health services like doctor visits or prescriptions. Coinsurance is like a copay, but instead of being a flat dollar amount, it's a percentage. So for example, let's say you have a 20% coinsurance and you have a $200 service rendered. So you would pay $40 for that service because that's the 20% coinsurance. And then the next is max out of pocket, and you'll hear me mention this a few times during the presentation. And that's the overall maximum you can pay for all cost sharing combined in any category or situation. So understanding the ABCDs, or the alphabet soup of Medicare. So first is Part A, and that's going to be hospital insurance, and that's going to cover inpatient services, skilled nursing, home health care, and hospice. Part B is medical insurance, and that's going to cover doctor visits, outpatient care, lab services, and DME, which is durable medical equipment. And those are things like canes, walkers, CPAP machines, oxygen, any portable medical device that you're using is generally going to be DME. Now, Part C are Medicare Advantage plans, and that's what we're going to be focusing here on today. Part C plans are going to include Part A, Part B, and sometimes Part D. They're going to have a maximum out of pocket, and they may offer enhancements like dental, eyewear, and more. Part D is prescription drug coverage, and that's going to cover outpatient prescription medications and certain vaccines. And the way a Medicare Advantage plan works is it's provided by a private health insurance company like SSM Health Plan. It's directly contracted with CMS, which is the Centers for Medicare and Medicaid Services. Provides all of your Part A, Part B, and Part D benefits all in one plan. Now, there are some plans that do not include the Part D, and we'll talk about that when we get into the benefits. They provide a maximum out-of-pocket protection. They include everything that original Medicare covers and may add additional benefits that Medicare doesn't cover, like dental, eyewear, in-home support, over-the-counter drug allowances, and more. One thing to note is you cannot have a Medicare supplement with a Medicare Advantage plan because Medicare Advantage plans replace original Medicare. One of the more complicated parts of Medicare is Part D, and that's the prescription drug coverage. Medicare standardizes their Part D, so they break it down into 4 stages. And you'll see these dollar amounts and these percentages are all standard across the board. So those are not unique to WellFirst health plans. So stage 1 is your initial coverage deductible, Now, none of our plans have a prescription drug deductible, but if your plan does, you have to meet the deductible before moving into stage 2. Stage 2 is your initial coverage, copay, and coinsurance stage. In this stage, you'll pay a copay or percentage, which is a coinsurance of the drug's total cost. Now, if a combination of how much you have paid and how much the health insurance has paid equals $4,430 within a plan year, you will move into stage 3, which is the coverage gap and donut hole. Now that 4,430 is made up of a combination of whatever you pay in either copay, coinsurance, or deductible, and how much the health plan pays for your prescriptions. So for example, let's say you have a $200 prescription and you have a $45 copay. So the insurance pays $155 and you pay $45. That full $200 goes towards the $4,430. If you reach the $4,430, you do move into stage 3, which is the coverage gap or the donut hole. When you're in the donut hole, you pay 25% of the cost of all of your drugs, and you stay in this stage until your total out-of-pocket cost reaches $7,050. Now, one thing to note is that when you reach the donut hole, you lose anything that the health plan has paid within the year. So anything that the health plan paid in stage 1 or stage 2, you do not carry over to the donut hole. However, when you're in the donut hole, you do get the 25% that you paid, and then the manufacturers pay 70%. So you get 95% of the cost of your drug, the total going towards the $7,050. If you hit that $7,050, you move into stage 4, which is the catastrophic coverage stage. When you're in this stage, you pay 5% or a small coinsurance, whichever is greater, and you do this until the year ends and you move back into stage 1. Some terminology for Part D, formulary, and that's going to be a list of covered drugs by the plan. Now, each plan is going to have its own formulary. The formulary is going to tell you things like which tier the medication is on. It'll also tell you things like if that medication requires prior authorization, if that medication requires a quantity dispense limit, so maybe they can only dispense so many pills within a 30-day period. So the formula will tell you any of that information. And then when it comes to drug tiers, each drug belongs to a tier, which determines how much you will pay for that drug. Usually the higher the tier, the more you will pay, excuse me. And then pharmacy network are options that you have when getting your prescription drugs. We commonly get asked what's the difference between a brand name and a generic drug. A brand name drug are drugs that are protected by a patent. The drug can only be made and sold by the company that holds that patent. Now, once that patent runs out, other drug manufacturers are able to use that active ingredient to make a generic version of that medication. Generics are approved by the FDA as having the same active ingredient as the brand name drug, but generally the generic will cost less. So Medicare Part D is optional, but it can be very valuable if you do take medications. There is something called a Part D late enrollment penalty. If you do not sign up for Part D when you are first eligible, you might have to pay a late enrollment penalty when you decide to enroll. Now, there are exceptions to this rule. For example, if you had credible coverage like through an employer, you don't have the penalty, or if you qualify for extra help, which we'll talk about on the next slide. The penalty is 1% of the base beneficiary premium. And the base beneficiary premium is the median amount that a drug plan cost. It's roughly about $33 right now, and that amount can change every year. So you take 1% of that base beneficiary premium and you multiply it by the number of months you went without Part D coverage, and that's how much your Part D late enrollment penalty is going to be. It breaks down to about $4 a month for every 12-month period you went without drug coverage. And that penalty does follow you for the rest of your life, and that penalty can change because that base beneficiary premium can change every year. For those with limited income or resources, Medicare does offer a program called Extra Help. Extra Help is a Medicare program that helps pay some of Medicare's prescription drug costs, such as monthly plan premiums, co-payments, yearly deductibles, co-insurance, and costs when you're in the coverage gap or donut hole. Those who qualify are not subject to the coverage gap or late enrollment penalty. And another unique thing about people who qualify for Extra Help is they have what's called a continuous special enrollment period. And what that means is they can change plans outside of open enrollment So at WellFirst Health, we have what's called an integrated delivery network. And that is a true collaboration between healthcare experts, hospital partners, and your health plan, leading to a streamlined and simpler experience for our members. Our roots are local, our health plan employees are your friends and neighbors, and you will find your primary care provider just down the road. Community is important to us. Our employees participate in a variety of voluntary efforts throughout the year to make local life a little better for everyone. Our plans offer a suite of premier benefits that give you a Medicare plan that covers your health needs, including dental, vision, and more. If you're looking for a provider directory, the most up-to-date listing is always going to be available on our website, which is wellfirsthealth.com/find-a-doctor. Or you can always call our customer care center and they can look up a doctor for you or send you a printed copy. And that phone number is 877-301-3326. So we offer a variety of pharmacies you can see. So we have what's called preferred and standard pharmacies. Members can save money by filling their prescriptions at preferred retail pharmacies and through our mail order pharmacies. Our preferred pharmacies are going to be all SSM health pharmacies, Walgreens, Walmart, and select community pharmacies such as the Medicine Shop. Costco retail and mail order are also preferred pharmacies. And you do not have to be a member of Costco to use the Costco mail order program. Members also have access to standard retail pharmacies that include most national retail pharmacy chains like CVS, many retail and grocery store pharmacies, and many independent and community pharmacies. So some timeline information and when people are eligible to enroll. So everybody has what's called an IEP or initial enrollment period. And this is the 7-month period during which you may enroll in a Medicare plan for the first time. It includes the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. If you are enrolled for the first time due to disability, your initial enrollment period timing is based off your disability dates. So if you receive disability for 24 consecutive months, on the 25th month, you are eligible for Medicare. Right now, we are in our annual enrollment period, also known as AEP, and that runs October 15th to December 7th of each year. During this time, you may make changes to your medical or prescription drug coverage. Any changes made during this time will take effect on January 1st of the following year. Medicare Advantage members have an additional enrollment period called the MAOEP, and that runs from January 1st to March 31st. During this time period, you may switch from a Medicare Advantage plan to another Medicare Advantage plan, or cancel your Medicare Advantage plan and return to original Medicare. During this time frame, you cannot switch from an Advantage plan to a supplement or from a supplement to an Advantage plan. And then there's a number of special enrollment periods. We already talked about one, which is the extra help. Some other ones include leaving employer coverage and a permanent move out of a service area. So if you move out of your planned service area, you do have a special enrollment period to enroll in a plan in your new area. Those are the most common ones, but there are many more special enrollment periods. So to be eligible for our Advantage plans, you must have Medicare Parts A and B and continue to pay your Part B premium. And you must be a permanent resident of our WellFirst Health Advantage service area. So in Illinois, that is Madison and St. Clair County, and in Missouri, that's St. Charles, St. Louis City, and St. Louis County. And just to note, you do have to reside within the service area for a minimum of 6 months of the year. So if you are a snowbird and you are sharing time between Wisconsin and, Missouri, Illinois, or Florida, you do have to reside in the service area for 6 or more months of the year. If you're residing in another area for more than 6 months, then you are not eligible for the plan. Our Medicare Advantage plans remove the hassle of having 3 different policies: original Medicare, a standalone prescription drug plan, and a supplemental plan to reduce out-of-pocket cost, all while providing coverage members need. So one thing is you get all of your Part A and Part B medical deductibles covered. There's a maximum out-of-pocket limit that protects members from large catastrophic health care expenses. Members can also earn up to $420 back on their Social Security check annually with our Part B premium reduction, and I'll talk about that when we get into the benefits. Prescription drugs are covered with manageable cost sharing according to our drug formulary. Now, the prescription drugs are only on the MAPD plans. The MA only plans do not have that drug coverage. All of our plans have coverage for preventative and comprehensive dental, 100% gym membership to our in-network health clubs through Silver and Fit. There's a $60 per quarter over-the-counter quarterly allowance. And I'll get into a little more details about that when we talk about benefits. Members also have the opportunity to earn wellness rewards and incentives for tracking their healthy behaviors. And you get great care from the doctors that you know and trust. So we have 2 plan offerings for 2022. We have the SSM Integrity Plan, which is an HMO point of service plan. And then we have the SSM Harmony, which is an HMO point of service MA only plan. So that does not cover the prescription drugs. Some of the added benefits with our plan, as I talked about the dental, so we cover both preventative and comprehensive dental through our partner Delta Dental. Our plans have no waiting periods, no deductibles, and coinsurance. It's just based off of a simple copay structure. And I always like to mention that it's the Delta Dental Medicare Advantage network. So the Delta Dental commercial network that you might have through an employer, not all dentists that take Delta Dental commercial take the Delta Dental Advantage. So you will want to check with your dentist to see if they accept the Delta Dental Advantage or Medicare Advantage, excuse me. We offer in-home support. We've partnered with Papa, a company that connects you with screened and trained Papa Pals who provide assistance with organization, light housework, technology, transportation. Your pal can visit you in your home or virtually for 10 hours per month, and your pal will be matched based on your shared interest and communication style. As I mentioned before, all of our plans offer a $60 per quarter allowance for over-the-counter supplies like bandages, pain relievers, cold and flu medications, and much more. Members can use their OTC card to shop online or at participating stores or over the phone. Participating stores include Walgreens, CVS, Kroger, and Walmart. All of our plans cover hearing and vision as well. You get a no-cost annual hearing and vision exam to an in-network provider, and then a $750 allowance towards the purchase of hearing aids to an in-network hearing aid provider, and a $200 eyewear allowance to an in-network provider every year. Some other benefits are our transportation. So we partner with Lyft and we offer 24 one-way rides each year to medical appointments or to the pharmacy to help keep our members well. If you ever discharge from a hospital or skilled nursing facility, we do have a meal benefit. We'll provide you with 14 meals that are delivered directly to your door, and they can be reheated and eaten at your convenience. They will last up to 14 days, and they can meet any kind of dietary needs that you have, like low sodium, low carbohydrate. If you're a vegetarian, they can meet any needs you have, and you will set that up through your discharge coordinator at the hospital. We offer a fitness benefit, which is going to include a fitness membership to any of Silver and Fit's in-network clubs. You get a home fitness kit, which includes a Fitbit, a Garmin, or other exercise equipment. And then they have an online library of over 8,000 on-demand videos, either on their website or through their mobile app. All of our plans cover additional chiropractic benefits to help members stay healthy and active. All of our plans also include access to the 24-hour nurse line, and this is a wonderful benefit. I have small children, so I use this probably twice a month, but it's great if you have a question about, if you need to go to the emergency room, can I go to urgent care? Can I wait a day and see, make an appointment? Or if you have questions about how medication interacts with each other, or any other thing that you have a concern about medical-wise, the trained nurses will be able to help you answer those questions. And then Living Healthy Rewards, you can earn up to $150 in rewards each year for completing healthy activities, like receiving a flu shot, going to the dentist, and getting your annual physical. Now, Medicare does not allow us to give out cash, so these are paid out in the form of gift cards. There's about 400 different merchants, big box stores, restaurants, Amazon, so there's something that'll meet everyone's needs. And those are all self-tracked on our website. And so you just keep track of your healthy activities and you earn points as you go along. So now we're going to talk about the two plans that we offer. So as you can see, the benefits are the same for both plans, with a big difference being that the Integrity plan includes Part D drug coverage and the Harmony plan does not. So first, I want to talk about what this HMO point of service designation means. So HMO point of service is in and out of network benefits. So point of service refers to out of network benefits. However, with any of the plans, if you have an urgent or an emergency medical situation, that is covered just as you are in network. Regardless you are traveling in or outside of the country, it is still covered just as you are in network. The biggest difference is if you are traveling outside the country, they're not going to be able to bill the insurance company. So you will need to keep all of your itemizations and then submit them to the health plan when you return, and we will reimburse you all but what your copays would have been. Now, one thing to note with the foreign travel is there is something that it does not cover, and that's what's called medical evacuation. What medical evacuation is, if you ever need to be transported from where you are back to your country of origin, that is called medical evacuation, and that is not covered by the health plan. I say this, I don't sell travel insurance and I don't endorse any travel insurance company. But if you are, spending money to go on a trip outside of the country, I recommend getting travel insurance that covers that medical evacuation. I had a client a few years ago who, when we were talking about this, he actually had a situation where his family was on a cruise and his mother-in-law became very ill and had to be med flighted from the cruise back to Florida. That med flight cost $65,000. They had travel insurance, luckily, and it was taken care of. So that's just an example. But like I said, so with the point of service, it refers to voluntary out-of-network benefits. So you're choosing to go to a non-plan provider. You can do that. Now they do have to accept the insurance and agree to bill us. But as long as they do, you can see them, you just have a higher out-of-pocket cost, which we'll touch on here. So with the SSM Integrity, there is no monthly premium, and there's a $35 per month Part B reduction. So the amount you pay to Medicare each month, that either comes out of your Social Security benefits, or if you pay them directly, that you pay them each month, it will be reduced by $35. There is no copay for primary care office visits in network, and there is a $50 copay for a primary care office visit out of network. Specialist copay is $35 in network and $50 out of network. Outpatient copay, such as outpatient surgical services, it's a $275 copay in network and a 20% coinsurance out of network. And that coinsurance is based off of the allowable charge, not the billed amount. So let's say they bill $1,800 for a service and Medicare says the allowable is $1,000, you're going to pay $200. Hospital copays, and this is per day for the first 7 days. So in network, it's $325 per day for the first 7 days. Out of network, it's $500 per day for the first 7 days. And again, if you are admitted to the hospital under an emergency situation and you are out of the area, that is paid as in network. So the out of network inpatient hospital, where you're choosing to go to a non-plan hospital to have a surgery or procedure done. Urgent care is both $35 both in and out of network. ER is $120 both in and out of network. And then the max out of pocket is $2,500 for in-network services, or $5,000 for in and out of network services combined. So any combination of in-network services totaling $2,500 or in and out of totaling $5,000, and all of your covered benefits will be covered at 100% for the remainder of the year. So the SSM Harmony plan, which is a Medicare Advantage only plan and does not cover prescription drugs, has the same benefits. It does not have the prescription drug coverage, and it instead of a $35 per month Part B reduction, it has a $50 per month Part B reduction. Now with the Harmony plan, because it does not offer Part D drug coverage, this is an excellent choice if you already have prescription coverage through state prescription drug assistance programs, TRICARE for Life, VA, or an employer plan. Why this is important is you cannot add a standalone Part D coverage if you enroll in the Harmony plan. If you enroll in the Harmony plan and then try to enroll in a drug plan, it will kick you out of the Harmony plan. So as far as the drug coverage goes, on the Integrity plan, there is no deductible. For a Tier 1 medication at a preferred pharmacy, there is no copay for a 30 or 90-day supply. At a standard pharmacy, it's a $7 copay for a 30 or 90-day supply. Tier 2 at a preferred pharmacy is $5 and $10 for a 30 or 90-day supply. At a standard pharmacy, it's $12 and $24 for a 30 or 90-day supply. Tier 3 is $40 and $100 for a 30 and 90-day supply at a preferred pharmacy, and it's $47 and $117.50 for a 30 or 90-day supply at a standard pharmacy. Tier 4 at a preferred pharmacy is $90 for 30 days and $270 for a 90-day fill. It's $100 and $300 at a standard for a 30 or 90-day fill. Tier 5, you pay 33% of the cost of the drug. As I mentioned before, when you're in that coverage gap donut hole, you pay 25% of the cost of all of your medications. And then in the catastrophic, you pay 5% or a small copay, whichever is greater. Our plan does cover vaccinations. So vaccinations that are covered by Part D include things like shingles and Tdap. There is no copay for these vaccines, and they are listed on our formulary as Tier 6. Now, one thing about Part D vaccinations is you do have to receive those at a pharmacy. You cannot get those at the doctor's office. There are some vaccines that are covered under Part B as in boy. Those include the flu shot, the pneumonia vaccine, and the hepatitis vaccine. And those can be done at a doctor's office, but any Part D vaccine needs to be done at a pharmacy. For anybody who's on insulin, we offer a senior savings program. You will pay $30 copay per fill at a preferred pharmacy or $35 copay per fill at a standard pharmacy for your insulin. And this is all the way until you reach the catastrophic coverage stage. So even in the donut hole for your insulin, you're still only paying the $30 or $35. To find the most up-to-date drug formulary, you can visit our website at wellfirsthealth.com/Medicare, or you can call our customer care center at 877-301-3326. You can request a hand-printed or hard copy of it, or they can answer any questions that you might have about specific drugs. So some of the values of our Advantage plans. So I'm going to cover things that are included in the plan that don't have any additional cost. All primary care health in person and telehealth, routine vision and hearing exams, meals post-discharge, transportation, in-home support, dental exams, cleanings and x-rays, vaccines, mammogram and pelvic exams, preventative colonoscopies, prostate cancer screenings, diabetic screenings, testing supplies and self-management training, and e-visits for certain conditions. Now, for diabetics, we do offer some really nice benefits. As I talked about, the $30 or $35 insulin copays at preferred and standard retail pharmacies. No copay for a continuous glucose monitor. It has to be a Freestyle Libre or Dexcom. No copay for PCP or lab services. 20% coinsurance for insulin pumps. You do get 2 additional cleanings per year for dental. And you can use your over-the-counter drug benefit to purchase things like diabetic socks or glucose tablets. So things to consider. One of the big things is obviously cost. And you want to think about both what, as I call them, the positive and the negative cost. So obviously negative costs are anything that you're paying. So things like copays and things along those lines, but then also positive costs. So for example, say you have a gym membership and you're paying $40 a month for that gym membership. When you join the plan, if that's an in-network gym, we're going to start paying that. So that's $40 a month that's back in your pocket. Another example would be, say you're currently paying out of pocket for dental insurance, let's say $50 a month. By joining this plan, you no longer need that. And so that's $50 a month that's back in your pocket. So you always want to look at both the positive and negative cost. You want to make sure the doctors accept the coverage, and you want to make sure that the hospitals you want to go to and the pharmacies you want to go to as well are covered by the plan. You want to make sure the prescription drugs you take are covered and how they're covered. If you plan to travel in or outside of the US, you want to make sure how that plan will cover you. If you're looking for those extra benefits like dental, gym membership, you want to make sure that the plan you're looking at covers those benefits. And then you want to be satisfied with your quality of care. And that's something that we strive very hard for, is to that quality of care, not only on the care delivery side, but claims, customer service, billing. We strive to have the best quality of care for you. So different ways to enroll. So you can enroll online at wellfirsthealth.com/Medicare. We can also do enrollments over the phone, and you can call us at 833-551-0565, and we can do that enrollment right over the phone. You can also mail your application. Now, I don't recommend the mail just because I've seen too many issues in the past with the mail, but if you do decide to mail your application, make sure you call before December 7th to make sure that that application was received. Because regardless of when you mail it, if it is not received in-house by December 7th, it's not a valid application. So if you do mail it, just make sure to check before December 7th to make sure that it was received. And any plan changes made during the annual enrollment period go into effect on January 1st. If you have questions, you can call our Medicare consultants at 833-551-0565. If you'd like to schedule an in-person appointment or an in-home visit with a licensed independent Medicare consultant, call 314-462-1279. Some additional resources. Medicare's website is a great resource to find benefit information. They also have a really nice tool called a Plan Finder. And you can actually, what I use it for is to look up drug costs. So you can go into the Plan Finder, input your prescriptions. It'll bring up all the plans that are available in your area. And it'll get into details like what your co-payments would be, what your estimated yearly drug cost will be, if you're going to get into the donut hole, if you're going to get into that catastrophic cap or catastrophic coverage. So it's a great resource amongst other things on that website. Social Security's website, ssa.gov, is another great resource when looking at benefits or different things that are available through Social Security. And you can also call them. Medicare's phone number is 800-633-4227, and Social Security's number is 800-772-1213. I want to thank you all for joining us today. And if you do have any questions, feel free to reach out to us. And we look forward to meeting any of your needs in the future. I hope you have a wonderful day.